Hello, dear guys. Today we'll discuss the topic of environmental pollutions and the disease which are caused by environmental and nutritional diseases. So everything which surrounds us, which are habits, which we used to treat like normal lifestyle, so which potentially can cause a death. Cause a disease, then of course it can cause might be death. So okay. So let's talk about. So now we heard about environment is in very bad situation right now because of industrial revolution we have, and due to this industrial revolution we have a lot of pollutants in the air, and we never in our life we encountered with this pollution in such large amounts as right now. Especially it affects ones who live in industrial centers in cities, in large cities with a lot of cars, yeah, with a lot of vehicles, and with some industry which let pollutants to live outside, and and now a lot of and we have organization which work we have a lot of organizations which work against this pollution and with a lot of uh, against some pollutants which released outside, and so today's lecture is, of course, I can't explain everything. We will, as always, I'll explain only short and constricted part of this topic. Yeah, and we can, and also there will be a SW for you for this topic. So, health effects. So first of all, we have a climate change. Climate change. So climate change. So you know that nowadays we have record-breaking global temperatures. So it's 2005, 2010, 2014 measures. So then we set successive high temperature records. And if we talk about northern countries like Canada, Russia, even Kyrgyzstan, yeah, Kazakhstan, and Northern Europe, it doesn't give effect to them, yeah, so because they are pretty safe with it, so because increased temperature for them is a kind of good idea, yeah, might be. But opposite thing of this, so that we have a lot of ice in Antarctica, and that's why even little increasing of temperature cause the melting of ice so from Antarctica or Arctic, Antarctica and Arctic, that this ice can melt, and then it will drown a lot of cities, because most of cities, 80% of a large cities, 80% of population is located in near the sea, and it will cause them, but it doesn't affect us, so it doesn't affect our topic today. It's just a point of generalized things. It's a point of ecology, and all of you heard that ecology is in very dangerous condition right now. But now let's talk about pathology which are causing right now. We are suffering from this. So, for example, these pollutants which are released in industrial centers, they affect cardiovascular, cerebrovascular, and respiratory diseases, which causing it. It's exacerbated by heat waves and air pollution. So now we'll discuss it. Gastroenteritis. So sometimes, gastroenteritis, it's inflammation of the digestive tract, which caused by might be by bacteria, other food or waterborne infectious disease caused by contamination as consequence of flood and disruption of clean water supplies and sewage treatment after heavy rains and other environmental disasters. So gastroenteritis is so sometimes happen. So usually it happens sporadically nowadays, and because we can control now, but still it's a very huge problem for the humanity. Vector-borne infectious disease. So vector-borne infectious disease, so for example, malaria in Africa, dengue fever in southern Asia, yeah. So which results from changes in vector number and geographic distribution related to increased temperatures, crop failures, and more extreme weather variation. And very important environmental health point is malnutrition. So when we don't eat enough food, so when starving, so it's became a meme, like it's people starving in Africa, yeah. And nowadays situation is much better, of course. So nowadays agriculture is takes less of population in all over the world. So for example, 100 200 years ago, so there almost 95% of population were busy in agriculture. But now technology is so evolved that might be 10% of people. So in developed countries, might be 5 to 10% of people, they are busy in agricultural in agriculture. That's why now we almost fight against this malnutrition in developed countries, but in developing countries, same as I said in Africa. So due to some political reasons, or might be due to environmental reasons, malnutrition is very common. And also don't forget about the population of the world. The population of the world increasing every year, increasing, and might and very soon it will lead to. So nowadays it's 7 billions, yeah. So it might be even more, and it's increasing. Especially it's increasing because of Africa and other developing countries. Because in developed countries, so you know that population growth is not so abundant. So because people understand that it's easier to raise two children instead of 8 children, yeah. But quality of these children and education of these children will be much better if it's only two, and they have enough funds to increase to feed them, and not only feed but also give education and all this stuff. Okay. Then this is temperature anomaly we discussed. So and you see this, and nowadays a lot of people think that temperature is not related to human, but actually now it's a fact. It's a scientific fact that temperature increases due to human activity. Due to human activity, and that's causes changes, and that's increasing of population. Increasing of population, it will continue in this rate, along with the increasing of temperature of the world. So worldwide increasing of temperature, it can cause productivity may decline by 10 to 25%, and especially in developing countries. So it's just, and you see in the same developing countries, population increases, but productivity may decline 10 to 25%. Of course, it might cause a disastrous starvation of people there. Okay, let's talk about toxicity of chemical and physical agents. So here I want to pay attention to this diagram. We have so what influence to us and how we can't avoid, but so some toxicity and physical chemical agents we can't avoid in our lifestyle. It's air, we have to breathe; water, we have to drink; and soil. We So soil is a source of feeding, but also in the soil we have some bacteria, or might be some other pollutants which we digest with the food, or maybe just with the dust we inhale it. So, but anyway, so this in which exposures we have due to this. And first organ we expose, it's the skin, lung, and gastrointestinal tract, because directly here we intake this pollutants. So that's why first of all we have first line of it's a kind of first line of defense in one sense, but in other sense it's a first line of damage. So these organs are damaged first: the skin, lung, and gastrointestinal tract. And from the skin, from gastrointestinal tract and lung, it can be absorbed in the bloodstream. So if it doesn't give effect in this area, so even this can absorb in the blood and then distribute to tissues, and different tissues might be injured. Because bloodstream distribute all over the body, so these pollutants can be distributed everywhere in our body, and that's why every organ is in danger due to pollutants, and so due to toxicity or any other toxic agents. Okay, and here we see and how our body results in it. So when it's distributed to tissues, it might intake inside the metabolism, and in metabolism we can metabolize it. We can easily metabolize it sometimes, so let's talk about poison. What is a conception of poison? Actually, so even in very in ancient period, it was posted that everything is a poison. Everything is a poison. Everything depends on dosage. Yeah, so that even hard, so even rock is a poison. Yeah, so if it's small rock, yeah, so it doesn't injure you. Yeah, so if it's a large rock, yeah, so which press on your body, yeah, so it's a poison. Yeah, so it's kind of, yeah. So of course it's a joke, but anyway, it implies what is the conception of toxicity and poisonous. So that's why everything depends on dosage. Okay, that's why so of course we can't avoid toxicity. Everywhere around we have any kind of toxicants and other some physical agents we can't avoid, but in small amounts our body can handle this, because our body used to have some poisons. So we live so human race lives all over the world, and it survived everywhere. That's why because our body is very adaptive and can adapt to this. And actually it is shown here, like we have metabolism, so in some of these poisons can be metabolized and then excreted, and then it leads to excretion. But some of metabolites they can storage inside our cells, and also it's one of the way of healing out of this poison. So we storage it in some areas of our body, and we'll discuss it. And but some of them they cannot be stored, and even if we have too many pollutants, too much pollutants entered inside our body, it causes toxicity. And we discussed about this a little bit in the first lectures about cell injury, that toxicity also, so toxicity can cause the cell injury, cell death. Okay. So what is the definition of poison we discussed? So xenobiotics. What are xenobiotics? It's exogenous chemicals in the environment that may be absorbed by the body through inhalation, ingestion, or skin contact, as I shown you here. So also chemicals may be excreted in urine or feces, or eliminated in expired air, or they may accumulate in bone, fat, brain, or other tissues. As I said, you see, it might be storage, it might be excreted. Okay, most solvents and drugs are lipophilic, which facilitates their transport in the blood by lipoproteins and penetration through the lipid components of cell membranes. And yeah, that remember this point, that most of lipophilic drugs and solvents they are stored in our fat, so in our skin fat. And not only in skin fat, but every fat we have in our body. And that's why sometimes we have delayed way of toxicity when we get thinner, yeah, when we starve. That's so might be due to dietary reasons. When for example, some drugs can be accumulated in the fat, but then when we get thinner, it releases in the blood and causes delayed toxicity. So when toxicants are not present anymore, but due to starving, so it releases in the blood. Okay, the reactions that metabolize xenobiotics into non-toxic products or active xenobiotics to generate toxic compounds occur in two phases. In phase 1 reactions, chemicals can undergo hydrolysis, oxidation, or reduction. Products of phase 1 reaction often are metabolized into water-soluble compounds through phase 2 reactions, or glucuronidation, sulfation, methylation, and conjugation with glutathione. Water-soluble compounds are readily excreted. So, how it happens? Okay. might be you heard about it already. So in physiology, discussed it in and also anatomy, histology. That we have a very good organ, so which plays a major role in detoxification. It's our liver. And okay, let's talk about, for example, in digestive tract. Yeah, so how it's utilized in digestive tract. So when we eat something, we eat everything. Yeah, so we eat a lot of actually directly poisons and or something which can be poisons after some little changes. And when we digest it, so we have a lot of gates which don't allow them. We don't allow us to penetrate inside the body. So okay, 1 minute. Okay, in the gastrointestinal tract, some of so a lot of, for example, even bacteria, they died because of acidic environment here, because of enzymes which present like pepsin, which split a lot of proteins, and that's why a lot of poisons which we digest, so they cannot pass they cannot pass inside our body if we digest it. And later, so we have a lot of mechanisms to destroy these pathogens. And but even if some poisons entered in digestive tract, you remember the portal vein system, that everything which is absorbed from the level less deeper than stomach, so everything absorbed into the portal vein and comes into liver. And then in liver, in the function of liver here is just to shift. So as if it's lipophilic compound, we have to shift this lipophilic to hydrophilic compound. So it's hydrophobic to hydrophilic compounds, and this is made by, as it's shown, glucuronidase or other sulfonamidation. So by this it comes back into the blood, and our kidneys can easily release it with urine. Or if we have compounds which cannot be transformed into the hydrophilic compounds, they are released with the bile and come back into digestive tract, and they are released with the fecal masses. So it's ideal things, and that's how our body works against it. Okay, in lungs. So same, in lungs we have other protective mechanism. So in lungs we have, so you remember the trachea, bronchi, and bronchioles. They are present with ciliary epithelia. So we have ciliary epithelia which removes the potentially poisonous structures with a mucociliary clearance. So we have in the respiratory tract we have a lot of abundant production of mucus. And if particles or some other compounds attach to the surface with help of cilia, it can be easily removed out of the respiratory tract just by coughing and then clearing throat. So every time you just clear your throat, actually it's a clearance of your lungs out of these poisons. And skin works a little differently. On the surface of skin, we have stratified squamous keratinized epithelia, so which is a very good protector against chemical agents, and that's why even if you put your finger, so if it has no lesions on the surface, if you put your finger even in a compound like sulfuric acid, sulfur acid, so it can not be damaged. So it cannot be damaged because this layer is very well insulator for our tissues. So that's why here our defending system of our body, it works. But anyway, here we have some lesions, but some compounds can penetrate these barriers. They can pass through these filters, and they can cause an injury to our body. Okay. The most important cellular enzyme system involved in phase 1 reaction. Phase 1 reaction, I remind you, it's metabolization into water-soluble compounds. It's P450 system. It is present in our liver, as I said. and most active in endoplasmic reticulum. It is most active in the endoplasmic reticulum of liver, and system catalyzes reactions that may either detoxify xenobiotics or convert xenobiotics into active compounds that cause cellular injury. So and not always it's for good. Yeah, you see that some potentially injurious components, they can be metabolized and became dangerous. Both types of reactions may produce as a byproduct reactive oxygen species, which can cause cellular damage. Of course, so activity of this enzyme so cause the formation of ROS, so which is we discussed the activity in later previous topics like chapter 2 in this book. Examples of metabolic activation of chemicals through the P450 system are the conversion of carbon tetrachloride to the toxic trichloromethyl free radical and the generation of DNA binding patterns, yeah, metabolite from benzopyrene, a carcinogen present in cigarette smoke. So this is okay. This we will discuss the conception of carcinogen. So, yeah, we discussed it already in previous topics. Okay, cytochrome P450 system also participates in the metabolism of large number of common therapeutic drugs such as acetaminophen, barbiturates, and anticonvulsants, and the alcohol metabolism. So, and what the role of P450 system is, we'll discuss later. Okay, but activity of P450 system enzymes are very it varies from person to person, especially it is present differently in people who use alcohol. So okay, just one easy little example. Yeah. So when you got to surgery, when they arrange you, make the anesthesia, always anesthesiologists always ask you, so do you drink alcohol or not? So because of what? Because if a patient drinks alcohol, so with a large frequency, but he has no diseases related to liver yet, this they have very evolved smooth endoplasmic reticulum and P450 enzyme system. And organism used to encounter with pathogens, and that's why that's why they have to administer more drugs. They have to administer more anesthesia for these patients, because if they administer less, so it won't give a proper effect. That's why this system sometimes leading the very very normal life, yeah, without this pollutants may cause a harder effect of other pollutants to your body later. Okay, environmental pollution. So let's talk about air pollution. So air pollution is a significant cause of morbidity and mortality worldwide, particularly among at-risk individuals with pre-existing pulmonary or cardiac disease. So the life-giving air that we breathe is so often laden with many potential causes of disease. Okay, so let's skip this boring definition. So air pollution happens. So here we have main pollutants in our air. It's ozone. So if you remember chemistry, so ozone is O3. So it's radical oxygen. So it can cause a radical oxygen in our body. So that's why all the dangers of reactive oxygen species are increased. That risk in the case of ozone exposure. Populations at risk are healthy adults and children, everyone, athletes, outdoor workers, and asthmatics. So every of this, every of us, yeah. So actually, it affects everyone. So, in which effects we have decreased lung function, increased airway reactivity. So that's due to ozone, so due to reactive oxygen species in it. Then it also can cause lung inflammation, so it's pneumonia. Due to injury of cells. You remember I said, yes, that mucociliary clearance is present in the respiratory tract, and lungs they can heal themselves, but if we damage directly cells of lung, so of course we cannot protect it effectively, and then a second punch happens, and some bacteria can easily enter inside. Okay, and decreased exercise capacity. So due to ozone, due to ozone, lungs are damaged, so less effective surface of lungs are present, and that's why less oxygen can be inhaled. And in asthmatics, it causes increased hospitalization if we have exposure of ozone. Okay, then let's talk about nitrogen dioxide. Nitrogen dioxide is a very common pollutant which is released by our industrial companies. Who are populations at risk? So healthy adults, asthmatics, children. So everything is in ozone. Pathology is almost similar. So it causes increased airway reactivity, decreased lung function, increased respiratory infections. So then sulfur dioxide. Sulfur dioxide, it is one of the most well-known pollutant. And most of work of ecologists is to prevent sulfur dioxide releasing into the air, because not it it affects not only humans not directly human tissues, but also it affects the rains, yeah, because this sulfur dioxide in air, they absorbed by our clouds, and when rain happens, it's known as acid rains. Might be heard about acid rains, and which cause damage of agriculture to agriculture, because not proper raising of agricultural products are happen due to sulfur dioxide presence there. And as you remember, sulfur dioxide with the water causes the formation of sulfuric acid, and that sulfuric acid, of course, injures for our agricultural agricultural to our agriculture. So, but injuries pretty same, yeah. So increased respiratory symptoms, increased mortality, increased hospitalization, decreased lung function. Acid aerosols. Acid aerosols. That also one of it's also made by sulfur dioxide, and that's why it also affects same population. Healthy adults, children, asthmatic. It causes altered mucociliary clearance, increased respiratory infections, decreased lung function, decreased hospitalizations. Same as I said before. And particulates. It affects children, patients with chronic lung or heart disease, or asthmatics. So particulates. Let's talk about particulates in little details, especially. Particulates, it's small particles of compounds which present in the air. So it seems like okay, so what? Yeah, so we have particles around, and we inhale it, and then mucociliary clearance can clear it and then release it outside. But in affected patients, like chronic lung or heart diseases, or in asthmatic patients, and in children where the systems are not aligned well, they cause a penetration inside the lungs, and our lungs have nothing but digest it. Yeah, so we have to digest these particles, and we little discussed about this in practical classes, that alveolar macrophages, as they have to swallow it, and these particles are usually carbon particles, and it causes the formation of anthracosis. So with mild anthracosis, if we have little exposure of this, but if it's too abundant, these particles can penetrate into the blood, and this blood. And when it penetrates into blood, it causes endothelial injury. So some of the particles cause the endothelial injury, and that's why. And of course, you remember that endothelial injury is increasing risk of formation of thrombi, and of course, it increases the mortality due to this. Okay, that's about smoking. We'll discuss. So you see, and actually, smoking is a typical. So it's when you do this pollutants directly into your hair, into your lungs. So you enter these particulates inside your lungs directly. So without torturing you just by yourself, you inhale this pollutants in your lungs. Okay, indoor air pollution. So which indoor air pollution we have? Okay, here I forgot to say about carbon monoxide poison. So what is a carbon monoxide poison? So actually carbon monoxide appears in large amounts appeared in a closed indoor in indoor, yeah, for example, now I know is that in Pakistan is very cold right now, so not normally cold, and some of your relatives, they start to use the energy of fire to heat yourself, yeah, to heat your homes. But it's this open fire inside our inside in home, so it can cause excessive production of CO, so carbon monoxide. And carbon monoxide has a very interesting effects. So carbon monoxide binds the hemoglobin much tougher, much closer than oxygen itself, and that's why if hemoglobin binds with carbon monoxide, it is unable to carry oxygen anymore, and that's why so blood gets unsaturated with oxygen. So you see, and it forms a carboxyhemoglobin in the blood. So that's why and what's so most dangerous here, because that carbon monoxide has no smell. We can't smell it. It doesn't stink, and that's why we can't detect the carbon monoxide exposure to us. And we can and we it has, yeah, 200-fold greater affinity for CO than for O2 hemoglobin, and that's a point. Okay, indoor air pollution, so it might be smoke from burning or organic materials. Um, so this containing various oxides of nitrogen and carbon particulates is an irritant that predisposes exposed persons to lung infections. Okay, radon. So radon, it's released. So okay, let's read about it. Radioactive gas derived from uranium is widely present in soil and in homes. The radon exposure can cause lung cancer in uranium miners. It does not appear that low-level chronic exposures in the home increase lung cancer risk, at least for non-smokers. So then in smokers, radon has more danger. And bioaerosols. They can contain pathogenic microbiologic agents such as those which cause Legionnaires' disease, viral pneumonia, and the common cold, as well as allergens derived from pet danger, dust mites, and fungi, and molds, which can cause rhinitis, eye irritation, and even asthma. So bioaerosols. So for best example here is of course bioaerosol of COVID-19. Yeah, so when we cough on each other, sneeze on each other, yeah, that's it forms the formation of bioaerosols which contaminated with the virus, and that's how we infect each other. Okay, let's talk about metals as environmental pollutants. So we have so why metals are so dangerous? So here we'll discuss these metals: lead, mercury, arsenic, and cadmium. These heavy metals, they are commonly associated with harmful effect in human populations, and they will be explained right now. Okay, first of all, we have to discuss why lead is so why these heavy metals are very injurious. Because it's absorbed. It binds to sulfhydryl groups in proteins. So in most of them, so also mercury, arsenic, and cadmium, all of them, they bind to sulfhydryl groups in proteins, and it refers with calcium metabolism, leading to hematologic, skeletal, neurologic, gastrointestinal, and renal toxicities. So you see, one effect of lead that affect a few proteins can cause changes all over the body. Okay, where we get it? So yeah, flecken. We have a flecken lead paint in older houses. And soil contamination pose a major hazards for youngsters. Okay, but nowadays actually we use the lead as a it's present in gasoline. present in gasoline. So you can say, so why we put lead in gasoline? Actually, they needed to increase the ability of firing of this gasoline. So it's necessary in our vehicles to increase the firing potential of this gasoline and increase the effectivity of this gasoline. But along with it, so this lead, so it works like catalyst of burning of gasoline. But along this lead releases in our environment, and if we check every overview, so we can find that in a dust, like in a dust near the road, we have a lot of dust near the road. We have a lot of lead components, and actually in well-developed countries, they give checkups of this lead contamination in dust, and it prevent it and they do some research, yeah, how to decrease the level of lead in air. Okay, we have it's something which is not important. Excess lead interferes with a normal remodeling of calcified cartilage and primary bone trabecula in the epiphysis in children, causing increased bone density, detects as radiodense lead lines. So if children is affected by lead, so we have this something like which is known as lead lines. So now it will be shown here. So see here you see this lead lines because of deposition of this lead near the epiphysis, and that's called it's a symptom of lead poisoning. Okay, exertion of lead occurs by way of the kidneys, and acute exposures may cause damage to proximal tubules. Lead inhibits the healing of fractures by increased chondrogenesis and delaying cartilage mineralization. So so lead also inhibits sodium and potassium dependent ATPases in cell membranes, an effect that may increase the fragility of red cells, causing hemolysis. Also exposure of this causes hemolysis. Due to exposure of aminolevulinic acid, dehydratase, and delta ferrochelatase, so we can remove it. Okay, morphologically, what we can see in patients with lead intoxication, in blood changes will be there. So one of the earliest signs of lead accumulation and are characteristic, consisting of microcytic microchromic anemia associated with a distinctive punctate basophilic steeping of red cells. You see, it impairs the proper formation of RBCs, and due to impairment of formation, the cells are going the microcytosis. So when in blood topic we'll discuss it also, but microcytic anemia, so it is injured RBC, and as well as they're injured, they will be easily destroyed by our macrophages of spleen and liver, and due to this our body destroys the cells much faster, and it causes anemia. This changes in the bloodstream from the inhibition of heme synthesis in marrow erythroid progenitors. So that's why it happens. Another consequence of this blockade is that zinc protoporphyrin is formed instead of heme. So instead of heme, so it can convert zinc protoporphyrin into the heme. Elevated blood levels of zinc protoporphyrin or its products, free red cell protoporphyrin, are important indicators of lead poisoning. That's what you have to check your patient to. Brain damage is prone to occur in children. In anatomic changes underlying the more subtle functional deficits are ill-defined. At the more severe end of the spectrum, changes include brain edema, demyelinization of the cerebral and cerebellar white matter. Causes necrosis of cortical neurons accompanied by diffuse astrocytic proliferation. So in adults, the CNS is less often affected by, but frequently a peripheral demyelinating neuropathy appears. So peripheral demyelinating neuropathy. So it's when nerves which used to be surrounded and insulated by myelin. So this myelin gets injured because Schwann cells, which are present there, they can't produce proper sphingomyelin there, and that's why these patients suffer with neuropathic pains, and then neuropathic pains cause the decreasing of sensation, hypersensitivity, cause the hypersensitivity later. And severe effects of this lead poisoning, it causes paralysis of the peroneal muscles. Okay. Gastrointestinal tract also is a site of major clinical manifestation. Lead colic is characterized by extremely severe, poorly localized abdominal pain. So you know it's lead joins with proteins and impairs the proper function of some enzymes and most of enzymes, and that's of course impairment of enzymes in the gastrointestinal tract causes the malabsorption, and of course it causes a colic like pain. And the kidneys may develop proximal tubular damage with intranuclear lead inclusions. Chronic renal damage leads eventually to interstitial fibrosis and possibly renal failure, and findings suggestive for gout. Okay, mercury. So mercury, it's a fluid metal, so which we used to use in thermometers, yeah. And everyone who ever uses thermometers, mercury thermometers, so you has broken it, yeah. And every of adult is get very frightened. Yes, all mercury is here, and it will cause some injury to us. And that's true. Actually, mercury itself is not dangerous. So when it's in liquid form, but actually salts of mercury and also steam of mercury is more dangerous. So especially in so yeah, I have some examples when a person. So I know the families where they're scientists, and they keep mercury just in free, so with a direct contact with the air, and they don't suffer with it, so they didn't have any diseases, mercury diseases. But mercury is dangerous when it's present near the heaters, or might be it come into the water with acids or some other compounds where they start to interact with, and you can suddenly swallow it. So medical disorder associated with a Minamata episode became known as Minamata disease. So it's when so what is Minamata? So okay, leave it. So but main injury of mercury, of course, is similar to lead. So also it's a heavy metal which impairs the proper function of some enzymes, and it causes acute tubular necrosis and renal failure, and other effects which were discussed in lead injury. Arsenic. It's not so it's arguable, is it metal or non-metal, but anyway, so arsenic salts interfere with several aspects of cellular metabolism, leading to toxicities that are most prominent in the gastrointestinal tract, nervous system, skin, and heart. Arsenic was a poison of choice of skilled practitioners of the Borgia and Medici families in Renaissance Italy. So you heard about this, yeah? That arsenic is a very common poison which we mixed up with food, and you can digest, and it causes immediate death. Today, arsenic exposure is an important health problem in many areas of the world. It's found naturally in soil and water, and is used in wood preservatives, herbicides, and other agricultural products. It may be released into the environment by the mining and smelting industries. Um, It's present in Chinese and Indian herbal medicine, and arsenic trioxide is a frontline treatment for acute promyelocytic leukemia. So we use some. So you said once again you can mention that so everything which is poisonous, it's poisonous in large amounts, but in less amounts sometimes it's even treatment. Yeah. Mm. Large concentrations of inorganic arsenic are present in groundwater in countries such as Bangladesh, Chile, and China. Okay, so what causes? Ingested in large quantities, arsenic causes acute toxicity manifesting as severe abdominal pain, diarrhea, cardiac arrhythmias, shock and respiratory distress syndrome, and acute encephalopathy. So everything is so it includes in a point that they cause an injunction with the proteins, and they also cause this injury. That's why it's almost it's very hard to differentiate between different metal injury to our body. So because it causes toxicity with very similar manifestations. Um, Okay, chronic exposure to arsenic causes hyperpigmentation and hyperkeratosis of the skin, which may be followed by the development of basal and squamous cell carcinomas, but it's not melanomas. So this exposure to arsenic as explainable. Um, and also it causes polyneuropathy. Polyneuropathy is the same as in lead and mercury injury. Arsenic inhalation is correlated with increased risk of lung carcinoma. Mechanisms of arsenic carcinogenesis in the skin and the lungs are uncertain, but we know that it has it present. And cadmium. Cadmium, so you see, cadmium is preferentially toxic to the kidneys and the lungs through uncertain mechanisms that may involve increased production of reactive oxygen species. So so cadmium is predominantly present in. So it's never present in. So it's a modern toxic agent. It's a modern toxic agent because cadmium poison is present. So here it's not shown, but I want to say it. So cadmium poison is usually happen in person who use cannabis, who inhale, so use cannabinoids and especially smoke cannabis, yeah. And cadmium injury. So nowadays, cadmium injury, it's predominantly we can say that yeah, this patient inhale, so they use a drug, so cannabinol drugs. So that's and because in countries, so in United States, I mean, so because in Latin America, they grow up this cannabis, and and they use it their soils, which are not supposed to be used for agriculture. So because they're affected with cadmium, and then with the drugs, it can enter into the body. So that's why almost every patient with a cadmium injury, so it's usually related to smoking of cannabis. Okay, industrial and agricultural exposures. More than 10 million occupational injuries occur annually in the United States, and approximately 65,000 people die as a consequence of occupational injuries and illnesses. Okay, let's talk about organic solvents. So, which organic solvents they're necessary for for our stains. Yeah. So when we use the stains, so we need to dissolve it in solvents, and when we stain something, so especially organic stains, they need to have some organic solvents, and when they dry it. So in a case of drying of this organic solvents, you have to leave the room. Yeah, you know that. So when we stain some stuff, so you need to leave it somewhere outside of the room. But if you stain something like walls, of course you need to wind it out. So wind it out and along for a long time, and don't let people be inside the room. Then we have polycyclic hydrocarbons. They are released during the combustion of coal and gas, particularly at the high temperatures used in steel foundries, and also are present in tar and soot. Polycyclic hydrocarbons are among the most potent carcinogens, and industrial exposures have been implicated in the causation of lung and bladder cancer. So polycyclic hydrocarbons actually they also produced during the smoking, so that's why also keep in mind that's why lung cancer is lung and bladder cancers are much more common in smokers than other people because of so one of effects is polycyclic hydrocarbons. Then organochlorines as halogenated organic compounds. It's okay, they're lipophilic. They used to be used in agriculture, and they nowadays it's prohibited to use this organic chlorines. So, for example, hexachloran is the best example of it. So it previously it was used like insecticide. So it kills insects in agriculture, and that why it widely was widely used. But then when we mentioned that patients who take part in agriculture, so they suffer with the cancer, lung cancer, much more abundantly than middle of population. And actually people who using food as a food with this pesticides or pesticides and insecticides like DDT, so diphenyl trichloroethane. So this is also another compound. So an inhalation of this also causes cancer. And then we have non-pesticide organochlorines. They include polychlorinated biphenyls and dioxin. So dioxins and PCBs can use skin disorders such as folliculitis and acneiform dermatosis, known as chloracne, which consists of acne, cyst formation, hyperpigmentation, hyperkeratosis. Okay, so that's okay. Let's leave it. Okay, and bisphenol A is used in synthesis of polycarbonate food and water containers and of epoxy resins that line almost all food bottles and cans. So that's might be heard about it. So don't use bottles, so plastic bottles, because there we have some poison, and this some poison is bisphenol. So because it's bisphenol A, because it is like it's used in synthesis of polyethylene, polypropylene, and other types of polycarbonate packages. Okay, vinyl chloride. Vinyl chloride is used in the formation of polyvinyl resins and mineral dusts. Okay, which mineral dust can cause it? Can cause some diseases. So usually it's mineral dusts are they cause diseases in mine workers. So mining of hard coal, silica. So for example, it's coal dust. So when you inhale hard coal during the mining, in silica. So it's sandblasting and stone cutting. Asbestos. Asbestos it's usually in mining, fabrication, and insulation work. So because it uses insulators, asbestos, beryllium, and all of them they cause pneumoconiosis. Pneumoconiosis. It's cause symptoms which is similar for chronic obstructive pulmonary disease, and it will be discussed in respiratory system, which here is chapter number 13. But still, you have to remember that injury to respiratory system is might be present by usual so mineral dust. But usually it's an injury for mine workers, and that's why we have keep of health wearings. Yeah, so we have respirators against it, but no, not everywhere it works properly. Then finally, my favorite one, effects of tobacco, and we will stop on this. What is the effect of tobacco we have? So First of all, tobacco. So, what's the composition of tobacco? It's a leaves of tobacco with the presence of nicotine. Yeah, so that's first think why we use so why population use cigarettes is nicotine. Yeah, so nicotine is a yeah. Sorry. Okay. Nicotine. So this nicotine has a temporary effect in our brain, and some of they said that it improves the mental activity for them, but so might be so it depends on person. Yeah. So for someone it's for bad, but smoking. So why smoking is so but nicotine itself has not too much severe effects. So nicotine itself injures only our blood vessels, because the nicotine is affecting our peripheral blood vessels. In our peripheral blood vessels, we have NO synthesis, nitric oxide synthesis, which causes the dilation of blood vessels. And nicotine inhaling, they block these receptors for nitric oxide, and then it impairs the normal contractility and relaxability of peripheral capillaries and arterioles. So in this increased conductibility and relaxation cause the impairment of normal blood pressure, maintenance of normal blood pressure. That's why chronic intake of nicotine they cause the impairment of blood pressure, and that will be discussed in next year, I guess. That's about regulation of blood pressure and how blood vessels are affected by nicotine. But second effect. But along with nicotine, we inhale not only nicotine. We inhale a lot of particulates. We inhale carbon monoxide. We inhale during smoking we inhale also compounds which are various compounds which are known as carcinogens. Look, cigarette leaves they're containing a lot of it's organic chemistry, and when we smoke, yeah, so it releases when we smoke, so it's a large, very huge temperatures there, approximately 150 degrees of Celsius indirectly in a contact here, and due to this produced a lot of different, absolutely different compounds, and these different compounds they inhaled in our body and they absorbed in our blood stream and distributed all over the body. That's why smoking is always we always can find every cancer type, and almost in every cancer. So smoking makes it worse. And so smoking can promote this cancer, not only lung cancer but also other cancer types. Okay, what direct effect of cigarettes? So not so okay. What happens with mucociliary clearance when cigarette smoking happens? We discussed a little bit in also in very first lectures that cigarette smoking so it causes the metaplasia of respiratory epithelium. Once again, I remind you that respiratory epithelium is aligned for mucociliary clearance to clean and release excessive amounts of mucus which with pollutants on it. Yeah, but when we inhale this cigarettes, so first of all, it causes the overproduction of mucus. Mucus is overproduced in respiratory tract, and secondary, so it causes ciliary damage. So the cells with the cilia on the surface, they died. They died, and the cilia can't facilitate the normal functioning. And then all the mucus, which is produced as a response to the smoking, so can be released outside properly, and they stuck inside the lungs. And you can mention, so you all of you have some relatives or might be friends, yes, who are smokers, and everyone has a has some friend who tried to break this habit, yeah. And one of things you mentioned, yeah, might be it's you. So when you stop smoking, so you mentioned that you can run far, yeah, so run much farther than before smoking. You can do exercises much longer times than while you're smoking. That's It happens because of what? Because mucus, so thick mucus which is produced due to smoking, so it interrupts the normal penetration of normal passage of oxygen into the lungs and normal oxygenation of blood, especially in exercises. So actually when you smoke, so in chronic smokers, they have so almost 50, 70, 80% of lungs, they're not working. Actually, for our normal activity, only 10-20% of lungs is enough to survive. So that's why right now also you heard that in COVID-19, when lesion leads to 90%, still patient can survive, right? And in smokers we have the similar situations. Most of lungs are already closed. Yes, so bronchioles are closed by mucus and cannot be properly removed. But patient doesn't mention it because he has no exercises, he has no overload. So yeah, okay, patient, I can't run for 500 meters. Yeah, so what? Yeah, I can walk. Yeah, so I can use a car. Yeah, for example. And that's why it doesn't bother a patient for a long time until it became irreversible. So when you stop smoking, yeah, if you're a chronic smoker, when you stop smoking, so what happens? Actually, all this metaplased epithelia, so squamous metaplasia of epithelia, so it's changed into ciliar epithelia, and all the mucus which were stuck in respiratory tract is getting temporarily getting removed. And also you can mention it that at mornings, so that patients who have broken habit of smoking, they have a very abundant coughing, yeah, and they cough and cough out a lot of sputum, yeah, so at every morning. And that sometimes some humans, they think, oh yeah, so I'm coughing because of no smoking. That's why, yeah, I want to break this habit. So actually, it's a bad idea to continue smoking in this situation. It's how your body clear your poisoned lungs. That's why. So if you break your habit of smoking, so please try to keep breaking, so don't smoke this time. Just wait for a little time, might be half year, and in half year or so your lungs will become absolutely clean, and then you can and then all the activity of your body will be very very promoted. Okay, so then myocardial infarction, peptic ulcer. So why peptic ulcer is present due to smoking? So when you smoke, so a lot of nicotine is adsorbed on the surface of oral cavity, and then you swallow saliva. Yeah, so of course you swallow saliva a little bit, and this nicotine, when it's entered into the stomach, we have nicotine receptors here in the stomach, and it's responsible for production of so in irritation. These receptors cause the overproduction of acids, stomach acids, and this stomach acid, so it can irritate the normal mucosa of the stomach. So that's why peptic ulcer is a very common disease for smokers, because it swallows the nicotine, and that's why my recommendation for ones who are still smoking, so spit it out. Yeah, so when you smoke, spit out the sputum. But do it in organized places. Yeah, so don't spit it so everywhere around. So it's bad to do. But when you smoke, so try to find the way to spit saliva outside. Then it causes systemic atherosclerosis, which also causes myocardial infarction, and also the brain infarction. It's caused by systemic atherosclerosis. But what is systemic atherosclerosis? We'll discuss later. Then and cancer of pancreas, cancer of bladder. So it's and a lot of other types of cancers. They are promoted by inhalation of cigarette smoke. Okay, and chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease is a disease which is related um, which is related to stacking of respiratory tract with the sputum, and then it causes a chronic inflammation in this area, and then even a small bacteria, so even little amount of bacteria will cause the inflammation, and without mucociliary clearance, it's very hard to treat these patients. And due to chronic inflammation, you remember that effects of chronic inflammation is one of this is fibrosis, and fibrosis and chronic destruction of cells so cause the decrease of lung possibility to restore, and that's why in chronic smokers, so with chain smokers, they have a very very high risk of COPD, chronic obstructive pulmonary disease, and they have very great chances to die because of pneumonia, which can be treated by antibiotics because we have no mucociliary clearance. Okay, so effects of alcohol, it's for our next lecture. So it's I guess it's enough for today. Let's check your attendance now. So no, so you're late, Muhammad Ali. So no, who's present right now? Okay, 55 students present. Okay, and then I'll save the chat messages and I'll check it too. Okay, thank you for attention. See you next time. Goodbye.
Thank you, sir.
Goodbye, sir.